Your first appointment here at Male Health Clinic, a step-by-step approach of what to expect. For most men, the hardest part isn't the treatment, it's making the first contact, not knowing what will happen, not knowing what will be asked, not knowing whether it will feel awkward. In this episode, I want to remove the uncertainty completely. Here's exactly what your first appointment at Male Health Clinic looks like, a step-by-step. I'm Steve Carter, founder of Male Health Clinic. This is probably the most practical episode I'll record and possibly the most useful for someone who's been thinking about getting in touch. The first step is a free, confidential, informal chat around 15 minutes on the phone. You can book this online, via email, by phone, or by WhatsApp. That informal chat is a conversation. It's not an assessment and it's not a commitment. If you tell me what's been going on in as much detail or as little detail as you want, I will tell you whether it's something we can help you with and what the next steps might look like. Nobody is pressuring you to book anything. If you decide it's not for you, that's completely fine. The conversation is free and there's no obligation. If you decide to proceed to the first assessment, here's what will be involved. We start with a detailed conversation about your history, your symptoms, what you've tried, what you've been told, and what the outcome you're hoping for. We will then carry out a clinical assessment. This is a hands-on evaluation of the relevant anatomy and function, what's working as it should and what isn't. I'll explain what I'm finding as we go. You'll understand what's happening, not just what I'm doing. By the end of the assessment, you'll have a clear explanation of what I believe is going on, what the contributing factors are, and what your options look like, including a realistic picture of what treatment might involve and what outcomes are typical. At the end of the first session, some men start treatment within a few days. Some think about it and come back. Some decide it's not the right option for them at this point. All of those options are completely fine. There's no pressure to commit on the day. If you do proceed with treatment, we'll agree a structure and schedule that works around you and your life and your work commitments. Most men come in once a week for 6 weeks or 6 sessions. Sessions are typically around 60 minutes or an hour. You drive yourself here and then you drive yourself home. There is no downtime at all. Nobody needs to know you're coming in and it's entirely your business. It's helpful to bring a note of your any current medications, any previous test results or any referral letters you have, and then roughly a timeline of how long things have been going on and you're experiencing symptoms. None of this is required though, but more information you provide helps with that initial appointment. It also saves time and helps me give you a more complete picture during the assessment. So that's it. That's the whole process. I hope that makes it feel a little bit more straightforward for you and less anxious, or also less awkward for you. If you've been thinking about getting in touch and the main thing that's stopping you is not knowing what would happen, now you know. Subscribe below for any more content that relates to male health issues. And when you're ready, the link for a free informal chat is in the description below. No pressure, no rush.